Longevity, dementia, and diet. Why lifestyle changes are the only way to prevent economic bankruptcy caused by chronic disease. So, as you can tell from the title, today we're going to discuss dementia, but even on a grander scale than that, we're going to discuss chronic disease in general, of which dementia is a major uh, one of the, say, four horsemen that is impacting us on a global scale from a chronic disease burden standpoint and the associated financial burden of that chronic disease. And so if we really want to thrive as a species, uh, because it's global, but also as a nation in America, we need to get a hold of our chronic disease burden, and that is things like heart disease, cancer, diabetes, and dementia. And so today we're going to dive into that a little bit. But first, let's look at some stats on dementia specifically. Alzheimer's disease accounts for 60 to 70% of dementias, but there are other dementias such as Parkinson's dementia, vascular dementia, etc. 1 in 10 people over the age of 45 in the United States report subjective cognitive decline. What does that mean? Well, subjective means there's not necessarily objective proof of it, like a lab or a diagnostic test, but subjectively, that person may be reporting short-term memory loss, say, or I'm forgetting names and numbers or my way around. Okay. That is cognitive decline. And before you have dementia or Alzheimer's, you first have cognitive decline. And so 1 in 10 people age 45 or older have that. Well, that's a lot of people. 6.7 million Americans age 65 and older in the US have Alzheimer's disease. So between in that 20-year window from subjective early cognitive decline at age 45 to 65, we're having many Americans diagnosed with Alzheimer's disease. Alzheimer's disease doesn't just cause morbidity, which is disability or loss of quality of life. It's also a major driver of mortality or death. Alzheimer's disease was the seventh leading cause of death in the US in 2022. Alzheimer's was projected, now we're past it, but was projected to cost the US $345 billion in 2023 in terms of healthcare, and it's projected to cost $1 trillion by 2050. Other estimates say Alzheimer's alone will bankrupt the US by 2030. I've seen similar statistics looking at type 2 diabetes alone could bankrupt the US by 2030. So, regardless of which one you're looking at, we need to get a hold of these things or else we're in trouble. And crypto isn't going to save us. Okay. And neither is a drug. Hopefully, by now, you understand that there's no magic bullet coming to save you. If one could be discovered, it would have been by now, and it's never going to be because there's no such thing. And if you've frequented this channel for any amount of time, you know that the key is the choices we're making at every moment of the day. There's 10 million new cases of Alzheimer's specifically worldwide each year. And in 2019, the global economic cost of dementia for the planet was $1.3 trillion. So a massive, massive burden by dementia alone on the globe and on the United States specifically. And so we need to change that. How do we change that? What do we do about it? Well, we have to address the burden of chronic disease. And in order to do that, I want to jump over to a new paper that was published by the Mayo Clinic looking at the burden of chronic disease. Here we are on the Mayo Clinic paper, and let's just start from the top. Chronic diseases like diabetes, heart disease, stroke, and cancer have been and continue to be some of the major causes of worldwide disability and death. The estimated cost of chronic disease is expected to reach $47 trillion worldwide by 2030. Okay, so that is, I believe, still more than the United States deficit. I know the US deficit was getting close to that number, but imagine that the burden of chronic disease, 47 trillion by 2030. In blue, individual lifestyle and behaviors and community factors play important roles in the development and management of chronic diseases. Many of these conditions, diabetes, heart disease, and respiratory disease, are preventable, period. Okay. It's not genetic most of the time. 2.5% of diseases are genetic. The other 97.5% are lifestyle and environmental. Those are things that we can control, and those are things that we are accountable for. Our society doesn't like accountability. We'd rather blame it on genes and be victims and take a drug because then we're not responsible. But reality is the final arbiter, and in reality, we are responsible. There are consequences, and we are accountable for our choices. And so, if we judge the choices made by the United States based on the health of the United States, we can see that the US has made a lot of bad choices for a long time, and we have to clean those up. So, these conditions are preventable. Their leading risk factors are physical inactivity, that's a choice. Poor nutrition, choice. Tobacco use, choice. Excessive alcohol, choice. Unfortunately, the investment in prevention remains small compared with treatment, both from a lifestyle perspective and a social determinants of health perspective. So, this is a public health paper. This is written by a person with a master's in public health. So, they're going to obviously focus on the public health responsibility as they see it. But really, your health is not the responsibility of the CDC or the FDA or the government or the public at all. It's your own individual responsibility. And so we shouldn't be relying on some government or nonprofit to come save us. We need to get ourselves educated on what are the right choices and make those right choices to the best of our ability as much and as often as possible. That's the only way we're going to change this chronic disease burden. Again, a drug's not going to save us, and a public health mandate isn't going to save us. We have to, one, live it individually, which then two, role models it for those around us and our children. And if we can raise our children in the right choices so that it's just second nature or first nature, then it's not an issue down the road. But for us, we have to learn and develop the lifestyle and behaviors. We have to do that hard work so that as we role model it, it's easy for the next generation. As the population ages, so does the prevalence of chronic disease. In addition, many individuals have multiple chronic conditions. In 2018, it was estimated that 27% of adults in the US had multiple chronic conditions. That's almost 3 out of 10. The cost of chronic disease to the American medical system is enormous, accounting for more than $1 trillion every year. Chronic disease accounts for the overwhelming percentage of preventable deaths and disabilities in the US and around the world. According to the World Health Organization, 63% of worldwide deaths in 2008 were caused by preventable diseases such as heart disease, cancer, chronic respiratory diseases, and diabetes. In 2011, the cost of the chronic disease worldwide was estimated to reach 47 trillion by 2030. So again, if we don't get a hold of this, we're sunk. And that's worldwide, not just in the US. And again, there's not a drug or a law that's going to do it for us. We have to make the choices, role model it. The leading risk factors for preventable chronic disease are physical inactivity, poor nutrition, tobacco use, and excessive alcohol use. These account for more than 50% of preventable deaths in the US, including cancer, chronic respiratory disease, type 2 diabetes, and heart disease. Let that number soak in. Over 50% of preventable disease deaths in the US are due to lifestyle choices. So, again, if our goal is longevity, and we've talked about this in previous videos, we don't just want lifespan, right? Lifespan is how long you live. We also want health span, which is the quality of life in the years that you live. You could have a shorter lifespan, but longer health span than someone, right? If you live till 70, but you don't have any disability or disease until you're 68, and someone else lives till 80, but they are disabled since age 65, you had a better health span than them. And so health span is what we really care about, right? It's the life in your years. The cool thing is if you improve your health span, you likely will lengthen your lifespan. And so that is our goal, optimal. However, the worldwide financial contribution to ameliorating these risk factors, ranging from access to healthy food and places to exercise to smoking cessation and cancer screening, is minimal. The percentage of the total national healthcare spending on public health initiatives in the US and comparable countries range from 1% to 6% in 2018. In the US, it was 3% roughly. So again, of all the money that government and public health agencies put towards, say, initiatives to have you get a vaccine or have you, lose weight by taking a drug, only 3% is aimed at lifestyle. And lifestyle will work better over time in a healthier way than any vaccine or any Ozempic or other currently sexy medication. So if public health and government agencies are truly serious about improving the health of the country, then they should put their money where their mouth is. So this author closes with, well, let's look at this real quick. The major risk factors for all of the aforementioned chronic diseases are intimately connected to lifestyle changes. Healthy eating, physical activity, quitting smoking, and reducing alcohol to zero require individual action and lifestyle changes. Individual action and lifestyle changes. The role of medical professionals in supporting these behavior changes cannot be underestimated. Okay, well, that's the part where medicine is failing big time. Most doctors are just as unhealthy as the average population, so they are in no way walking the walk. They are not role modeling. That's a failure. Another failure is, for example, when they're going to prescribe a drug, many drugs, you're supposed to recommend 6 months of intensive lifestyle change like diet and exercise before prescribing a statin drug to lower cholesterol. Well, that's just, thrown in there. It's not followed through on, and it's even no longer mentioned in commercials. And so, that's lip service, but never actually practically implemented. And so medicine has failed the population that way. Again, we need a shift in paradigm, and it starts with the doctors too. Without prevention across the world, we will likely continue to see increases in chronic disease at younger ages and all the consequent results of growing disability and economic consequences. This will also be a challenge to lifestyle medicine given the public's appetite for easy fixes. But as providers, our efforts are sorely needed now more than ever. Our future depends on it, right? So we must make this change, and we must change our get rich quick, get healthy quick, magic bullet attitudes, because that doesn't work. Okay, we have to accept that and pull up our bootstraps and do the work. So what is one way we can do that? An anti-inflammatory diet. Whenever an anti-inflammatory diet is studied, it often has massive benefit for whatever disease or process it's studied against. Here's a study published this year from the Journal of the American Medical Association looking at an anti-inflammatory diet and dementia in older adults with cardiometabolic diseases. This is a cool study because it's looking at older adults that already have cardiometabolic disease. So diabetes, for example, heart disease, stroke, okay? And then they say in people with those, what is their risk for dementia if they're eating a pro-inflammatory diet as opposed to an anti-inflammatory diet? And that's interesting because inflammation, as we've talked about many times, is the lowest common denominator for chronic disease. Whether we're talking about cancer, heart disease, diabetes, multiple sclerosis, whatever it is, the more inflamed you are, the higher the risk for the disease in question. So we must find any and all drivers of inflammation. And if we can put those fires out, then we prevent the downstream disease that would develop in the individual. So let's look at this paper. Inflammation has been proposed as a mechanism linking cardiometabolic disease to increased risk of dementia. In this paper, they used the United Kingdom Biobank, which is an ongoing community-based study. And what they did is they looked at over 84,000 dementia-free older adults, which was defined as older than 60 years old, and followed them for 15 years, up to 15 years. And they gave almost 9,000 of them a brain MRI during that time. And what they wanted to see is Here we have 84,000 plus 60 plus year old adults with cardiometabolic disease. Let's follow them for 15 years and see who develops dementia. And they looked at how do they eat and how does that relate to it. So they have these people with cardiometabolic disease, and then they measured their dietary inflammatory index. Okay, was it anti-inflammatory, was it neutral, or was it a pro-inflammatory diet? And what they found at the end was that dementia risk was 31% lower among people with cardiometabolic disease that ate an anti-inflammatory diet compared to people with cardiometabolic disease that ate a pro-inflammatory diet. So even though they already had cardiometabolic disease, which by definition are inflammatory, if they ate an anti-inflammatory diet, they had 31% lower risk of developing dementia. On the brain MRIs, participants with the cardiometabolic disease that ate the anti-inflammatory diet, when compared to the pro-inflammatory diet, additionally had significant larger gray matter volume and smaller white matter hyperintensities. So their brains were healthier. They had less brain shrinkage and less brain damage. So that's huge. What does that mean? It means if we can eat an anti-inflammatory diet, that is brain sparing. That promotes healthy brain, even in people with chronic disease already. So I think there's a cool graphic down here I wanted to share with you to drive it home a little bit better. And that's right here. So let's look at this. If we come over here, what we're looking at is the analysis of cardiometabolic disease status and dietary inflammatory potential on dementia risk. So if we look at the one I circled in the red box here, this graph looking at dementia risk, diet category compared to risk of dementia. Okay, so this light gray one down here, call it number one, that group is cardiometabolic disease free and anti-inflammatory. So these would be healthy people. They didn't have any cardiometabolic disease and they were eating an anti-inflammatory diet. So what's the risk over time of dementia? That's the normal risk. It's a risk of 1. They didn't have any increased risk. Okay, if we look at box number 2, these are cardiometabolic disease-free people that eat a neutral diet. And so they have a slight increased risk of dementia development over time. Box 3 was cardiometabolic disease-free people that eat a pro-inflammatory diet, and their risk is now up. Okay, but now we see it gets much worse when you have cardiometabolic disease already. So if you have someone that has cardiometabolic disease eating an anti-inflammatory diet, their dementia risk is higher than the person without cardiometabolic disease eating a pro-inflammatory diet. Why? Because if you have cardiometabolic disease, you're already inflamed. That is an inflammatory disease. So you are already at a greater risk of dementia because of those diseases. But eating the anti-inflammatory diet, as you can see, is going to be better for you than eating a neutral diet with those diseases, or eating a pro-inflammatory diet with those diseases. Okay, so people with cardiometabolic disease that are eating neutral or pro-inflammatory have associated increased risk of dementia development. Why is that important? Well, again, if you're eating pro-inflammatory, you're piling on the inflammation that's already there to drive your initial diseases. So we can reduce our risk. Remember, these people, number 4, had a 31% reduced risk of dementia development from the number 6s. And the difference was what they were eating, okay, changing their diet. And likely it'd be interesting if they expanded this study to say, well, how did the markers for their cardiometabolic diseases change over that 15 years as they ate the anti-inflammatory diet? Probably those improved, right? And so the person got healthier overall because to develop a cardiometabolic disease, which is a lifestyle disease like type 2 diabetes, a major driver of that is a pro-inflammatory diet. So by switching to an anti-inflammatory diet, they prevented their dementia development, but also probably helped what other underlying chronic disease was there at the beginning of the study. So I hope this is eye-opening for you. I know it's pretty intuitive if you've been in the healthcare or the natural health space for a while, but it's nice to see that big journals and big organizations that supposedly are interested in promoting health are undertaking studies like this and showing data that is undeniable. So the key now is to take head knowledge and make it practical and implement it in our lives so that we can get healthier by choice and by actions, and in so doing, role model it, like I said, for our kids and the people around us. So if you're not eating anti-inflammatory, or you've just finished up a holiday and you fell off the wagon while you were there, it's important to get back on that anti-inflammatory diet and stay on it even through the holidays, because there's always going to be more holidays or more birthdays or more anniversaries. And so again, the key to a lifestyle is I do this whether I'm having a birthday, an anniversary, or a holiday or not. This is how I live, and I'll make those things fit my lifestyle instead of let them dictate my lifestyle. So let's open this up for questions.
Yeah, I was just wondering if there's any studies that show like you didn't eat anti-inflammatory for half or more of your life, like 40 years,
Mhm.
and can you reverse the damage or just stave off any additional damage?
Yeah, there's lots of papers like that. It depends on how far you are along. So matter has limitations, right? So that if say someone was just diagnosed with type 2 diabetes, so you have a person that's had a type 2 diabetes diagnosis for 6 months, and you've had a person with a type 2 diabetes diagnosis for 10 years, can you reverse type 2 diabetes? The answer is yes, but the caveat is it's easier to do it in a someone that's only had it 6 months than someone that's had it 10 years. Can you reduce type 2 diabetes in someone that's had it for 10 years? Maybe not. Could you prevent progression? Probably. So again, it depends on where the person is on their journey. But at any time, no matter where you are, if you're doing something that's pro-inflammatory and you've got an inflammatory disease, reducing the inflammatory burden is going to be helpful. That's whether that's preventing further progression and or promoting reversal remains to be seen in an individual case, but it's always a good choice.